This lesson is for dealing with subjects with mental illness and developmental disabilities. The terminal performance objective for this lesson is given an encounter with a subject with a mental illness, identify proper procedures to deal with these persons in accordance with Dalton Police Department Policy 4.23. Our enabling objectives are to define developmental disability, demonstrate an understanding of the procedures outlined in DPD Policy 4.23, define mental illness, identify proper techniques to be used when dealing with a subject with mental illness. Something that we need to understand is that dealing with subjects with a mental illness or developmental disability can be a challenging and unique situation for any officer. Being able to recognize the symptoms and effects of developmental disabilities or mental illness will equip you to better recognize and deal with these types of persons. It will also allow you to be prepared to deal with them in a manner that will best serve both their needs and the department's law enforcement mission. One of the things we need to do first is look at the definition of developmental disability. This is a potentially severe chronic disability. Could be anything that has to do with physical or mental impairment, combination of those types of impairments. It results in substantial functional limitations to major life activities such as understanding and expression of language, learning, mobility, self-direction, self-care, capacity for independent living, and economic self-sufficiency. Some of the common symptoms you may see associated with this are things like difficulty communicating and expressing oneself. Could be anything as far as communication by pointing or gestures rather than using words, repetition of phrases or words, repetitive body movements, and these types of movements could be something that's harmful to themselves or others. Little or no eye contact, tendency to show distress, laugh, cry for no apparent reason, uneven gross or fine motor skills, unresponsiveness to verbal commands, aversion to touch, loud noise, bright lights, and commotion, and also no real fear of danger. Could be something like oversensitivity or undersensitivity to pain, or behavior that causes injury to themselves, again, as stated above. As a law enforcement officer, you come in contact with many different types of people on a daily basis. So it would be very common for you to come into contact with someone with a developmental disability, and it could happen on a regular basis. Some of the things and some of the situations that you may encounter a person with a developmental disability could be a situation of wandering, developmentally delayed or autistic, or other types of developmentally disabled persons sometimes try to evade their parents, supervisor, caregiver, or other institutional setting, and they may be found wandering aimlessly or engaged in repetitive or bizarre behavior in a public place or inside stores. Another thing that you may come in contact with someone in would be in a medical emergency, such as a seizure. Some developmentally disabled persons, such as those individuals suffering from autism, are more subject to seizures and may be encountered by police in response to that type of medical emergency. Another encounter could be disturbances. In this situation, it may develop and a caregiver may be unable to maintain control of the person who is engaging in a type of behavior or tantrum, and they may end up contacting the police to respond to assist them in dealing with this individual. Strange, bizarre behavior could be in a public setting, could be picking up items in stores that's perceived as shoplifting, anything that could be inappropriate laughing, crying, personal endangerment, strange and bizarre behavior called in by someone as a concern. You may end up having to deal with this individual and try to resolve the situation. Another thing that could be called as a police service or someone could call for police services would be offensive or suspicious persons, and this could be anything that is socially inappropriate or unacceptable acts. It could be anything such as ignoring personal space of an individual, could be called in as someone being annoyed by a certain type of action, or it could be inappropriate touching of others or themselves in a public place. Sometimes individuals with developmental disabilities are not often conscious or acceptable or not conscious of acceptable social behavior due to that developmental disability. So when dealing with these types of individuals, what we need to think about is we need to speak in a calm voice, use non-threatening body language, try to keep the commotion down, and this could be anything from any type of individual that's causing a commotion, could be another police officer, could be another agency involved. Anything that is causing that commotion may need to be removed from the situation until it is better able to, or we are better able to get it under control. Try to keep animals away that could create an issue, create a problem. Look for any type of personal identification. If you can, call the contact person or caregiver of that individual if they are anywhere nearby. If you know who this person is, you may want to try to get them involved and can help de-escalate the situation. You need to prepare for a potentially long encounter. This is not something that's going to be over all the time in just a matter of a minute or two. Sometimes law enforcement officers have the tendency of trying to get the call taken care of in the quickest manner possible. However, in a situation like this, we probably need to step back, take a little extra time, and make sure that it's handled in the best and safest manner for the officers involved and also for the person we're dealing with. Try to repeat short, direct phrases in a calm voice. And also be attentive to any type of sensory impairment, such as don't touch the person, try to use soft gestures, use direct, simple language, and don't interpret odd behavior as belligerent. You also need to be aware of different forms of communication. The person may not have the ability to speak, but may have the understanding of how to write something or read. Also, gestures could be used if necessary. As far as like hand gestures and trying to get that person to understand what you're saying. It's also important that you don't get angry at any type of antisocial behavior and maintain a safe distance as you normally would in a situation, because again, if there's a difference in communication, or if you're not understanding one another, it's very important that you stay on guard, keep your guard up, and make sure this situation's handled so you can be safe and also the person involved. There will come a time to where the person has to be taken into custody, and this is understandable in the nature of the job that we perform. But when doing that, if needed, contact your supervisor for any type of advice, summons the person's caregiver, and then try to employ calming and reassuring language and de-escalation protocols to try to diffuse the situation as much as you can. Sometimes your attitude, your communication skills, things like that can be way more important than any type of physical skills that you have. You can de-escalate that situation without having to use any type of force or any type of hands-on situation, and can be avoided. If it's a situation that requires an interview or interrogation, you need to make sure that you don't interpret lack of eye contact and strange actions or responses as indications of deceit, deception, or evasion of those types of questions. It may be the person just doesn't understand what you're saying and doesn't understand the situation that's going on. Try to use simple, straightforward questions, and you're not going to be able to employ common interrogation techniques, suggest answers, attempt to complete thoughts of the person, slow to respond, or pose hypothetical conclusions. This is not a situation to where you would want to do that. You want to make sure that you're very patient during an interview or interrogation of someone with a developmental disability. You could also contact the district attorney's office if you had any questions about this, and see if they can give you some additional information as far as how to appropriately interview or interrogate this individual. So now that we've kind of looked at developmental disabilities, let's briefly look at mental illness. The thing to understand is dealing with an individual with a mental illness or developmental disability can be handled in pretty much the same manner on a lot of different occasions. Trying to keep the commotion down, things like that. We use a little bit of a different approach when dealing with a mental illness. When we look at mental illness, we define it as a psychiatric or psychological disorder characterized as an illness that affects cognition, perception, communication, and it could be something that significantly interferes with the performance of major life activities. Social interaction, learning, thinking, communicating, and even sleeping could be involved in this as far as the effects that it has on the individual. When we deal with an individual with mental illness, we can use the TACT model, TACT model. It stands for tone, atmosphere, communication, and time. And as we're looking through these, you'll see that a lot of these are the same as we were dealing with individuals with developmental disabilities, but there may be a few other key points that you want to take note to in this section. In the TACT model, when we look at tone, we need to make sure that we're calm, non-confrontational, remain calm, avoid overreacting, talk in a firm, controlled tone, but try to establish a leadership role in the conversation. Avoid touching or staring at the person. Try to be respectful. Show respect and dignity through verbal comments, physical actions. Be aware of any kind of sensitive or cultural differences, and then try to deflect verbal abuse and avoid verbal challenges. You're going to need to make sure you're patient, attentive, reassuring, and empathetic and truthful during this encounter. So this is all things that can control the tone of dealing with this situation. When we look at the atmosphere, we want to make sure that we try to keep the scene calm and controlled, try to reduce distractions, and this could be anything as upsetting influences, disruptive people, radios, sirens, bright colors, flashing lights, and there's a laundry list of things that could be added to that. When looking at communication, try to make sure that only one officer at a time is verbally engaging this individual. Tell the person they're safe, that you're there to help. Try to speak calmly and slowly using simple language, and then use your active listening skills when dealing with this type of situation. In time, whenever possible, slow the situation down. Give the person time to process the information. Give the person time for emotions to decrease, rationality to increase, and try to take time to plan something. Taking time to develop that plan instead of just rushing in without any type of plan at all. Do not urge or agree with any type of delusions or hallucinations, and discuss topics that are reality based. If that person is hallucinating, try to get them to focus on your voice, and then ask what the voices are saying to try to help assess whether the person's fears are increasing or decreasing as a means of assessing violence potential. These types of situations have the ability and possibility of becoming very violent encounters, and we see this on a regular basis throughout our country with law enforcement officers involved. So you need to make sure that you are on guard, extra aware of what's going on, and try to read this person's body language the best you can to determine if this is going to potentially be a violent encounter. So during this lesson, we've talked about developmental disability. We have demonstrated an understanding of the procedures outlined in Dalton Police Department Policy 4.23. We've also defined mental illness and identified proper techniques to be used when dealing with a subject with a mental illness. If you have any questions as far as this lesson is concerned, please feel free to contact me or refer to Dalton Police Department Policy 4.23 or contact your supervisor.